sometimes a single sentence can teach us so much about something huge, like the very essence of healthcare. Well, today, that's exactly what we're doing. We're unpacking one powerful, really simple statement that honestly reveals the true heart of care.
And here it is. It's from Dr. Annie Zimmer. She says, I'm a pediatrician. One of the best parts of the job is getting to know a family and watching them grow and welcoming new siblings. They're not my family, but they kind of are. So, what does this simple, almost casual statement really tell us about medicine and, just human connection? Let's break it all down. Okay, so to really get the full weight of her words, we've got to start right where she does, with her professional foundation. See, she starts with, I'm a pediatrician. Now, this isn't just a simple introduction. It's a huge statement of her identity, and it grounds everything she's about to say in years of medical training and professional responsibility. It really sets the stage, providing that professional context that makes her final point hit so hard.
So, what does a doctor, a scientist trained in all the complexities of the human body, what do they consider the best part of their job? Well, the answer might not be what you're thinking.
This contrast right here is everything. We usually assume a doctor's biggest win comes from the clinical stuff, right? Like cracking a tough diagnosis or prescribing some life-saving cure. But Dr. Zimmer points to something totally different. For her, it's not about the transaction, it's all about the relationship. The reward isn't just fixing a problem, it's about sharing in a family's journey. And that journey? It is not a quick sprint. The joy she's talking about isn't found in just one appointment or some momentary success. Nope. It's something that gets built up, bit by bit over a long time. This really shows you that timeline perfectly. It all starts with that first meeting, probably with some really nervous new parents. Then comes the whole process of watching them grow, through all the fevers, the checkups, the scraped knees. And finally, the cycle continues when she gets to welcome new siblings into that same family. It's about becoming woven into the actual fabric of their story, one visit at a time. And this brings us right to the heart of her statement. That one phrase where the professional line just beautifully blurs into something so much deeper. They're not my family, but they kind of are. It's such a paradox, isn't it? She's holding two truths in her hands at the exact same time. She acknowledges the professional reality, they're not my family, but then she immediately follows it with this deep emotional truth. But they kind of are.
It's a fantastic question, really. What does it actually mean to hold that unique space in someone's life? To be kind of family? Well, it means the bond isn't about blood or legal ties. It's a relationship forged in something else entirely. In trust during really vulnerable moments, in shared experiences of worry and then relief, and in that profound responsibility of caring for someone's child. It's this unique, powerful connection that's built on the very essence of care itself. So let's pull all this together. What can we all take away from this one doctor's reflection? I mean, how does this insight apply beyond just her pediatrician's office? First off, her words are this amazing reminder that real care is relational. It's not just a service you buy. Second, that kind of family feeling doesn't happen overnight. It is earned over time through every single shared experience. Third, this whole idea reframes empathy not as some soft skill, but as an absolutely essential professional tool for anyone in a caregiving role. And finally, and this might be the biggest one, it confirms that a genuine human connection is right at the very center of healing. So I'll leave you with this to think about. Knowing that for so many doctors and nurses, the real goal is to become kind of family, how might that change the way you see your next appointment or your next interaction with anyone in healthcare? It's definitely something to consider. Thanks for joining us.